is Dr. Ted Johnson with IPSO, which is the International Partnership for the Study of Occlusion. Did I get that right, Dr. Johnson?
You got it right. That's correct.
Okay. And we love Dr. Ted Johnson because he sponsors our CE credits. No, that's not the only reason we love Dr. Johnson.
Well,
Uh,
that was what it was.
we go way back, many, many years of working together, and you are still in dentistry even though you're retired. You're in Colorado, and you're still leading the course, and we're just so excited to hear what you have to share with us about occlusion. We have been showing the video that you sent, about the 8-minute video in past presentations, but now we get you live, so I want you to share with us what's going on, what's coming up with IPSO, some success, whatever's on your mind.
Okay, great. Yeah, I won't take a whole lot of time, but 5, maybe 10 minutes, something like that. So anyway,
Sure,
thanks
that's
for
right.
having me here and letting me speak a little bit about IPSO. It was 20 years ago this year, Paula, as you mentioned,
Wow.
when I first met you and Ricky Bobby and Karen and Greg Raymond. And I thought Ricky Bobby was just an I in the disc at that point. So I'm super pleased
I've
that it's
matured.
more than having some D and C in there. So anyway, I've worked 20 years with both Eric and Paula. They became integral parts of my team. And so if we weren't talking monthly, we were talking every day or every week, certainly sometimes, depending on what the issue might have been. So I couldn't, when I joined up and went to the dental boot camp course in 2002, and I think it was down in South Carolina at Hilton Head, I was in trouble with financially. I didn't have all the stuff that the numbers that Eric just put up right now. And so they helped get me back on board. As I was sitting here, I was thinking about, we had a vision challenge to put together. And I think I had 5 things, but I remember 3 of them. One was to be insurance free, and I did that. It amazed me that we were able, because of the vision, I was able to do what I envisioned. I wanted a building that was my own instead of renting out of a shopping center. I did that. And the last one was to be part of a CE, have our own CE program like we have with IPSO, and we've done that too. So it was amazing to me that, and we did all that in fairly short order too. So it was amazing to me as I look back on it right now. So I'm a partner right now in IPSO, which is as Paula said, is the International Partnership for the Study of Occlusion. There's 3 of us. It's a dental CE program dealing with TMJ issues and occlusion and airway issues as well now. That's new over the last, 6 or 8 years, something like that. We're ADA and CERP certified, which we're really proud of. It's a big deal. It's very stringent, and they hold our feet to the fire, that's for sure. We're the oldest, probably the oldest CE organization dealing with occlusion and TMJ issues that you've never heard of, because we don't advertise. It's all word of mouth. When we get enough dentists that want us to speak, then we put it together and bring it on. So there's no marketing that we put together. So, and that's probably because we didn't want to be a full-time program, because at the time we were all, there's our website right there. We were all practicing. Ken's still practicing, or practices as an instructor at the CU Dental School, University of Colorado, and he's now the director of the occlusion course there. And Dan's practicing in South Denver. He's also he's in private practice, and he's also the dentist for the Colorado Avalanche hockey team as well. So there you can see Dan and Ken. We call ourselves international because right now Dan and Ken are both over in Birmingham, England, teaching the same course that we're going to teach here in Denver in June of this year. And I'll go into some of that because we'd like to have some of you folks there if you have interest. So they just sent me, I don't know, I can send a picture of that. They just sent me a picture of them teaching. Let's see if I can.
Okay.
There's Dan and Ken. And then, if I can work my phone here, this is their course. In Birmingham, England. So we're legit that way. So anyway, looks like they've got a good course, a good number of people there at their course.
Awesome.
Let's see, we follow the teachings of Niles Gachet. He's one of the old occlusionists. He graduated in the 50s, and he's also the developer of the DNR marketing, or not marketing, but articulator system and instrumentation. He's he just passed away in January of this year. He was in his mid-90s. He was a genius. And Dr. Bassett, who Paula knows, was buddies with him. He's retired now. He's about 85. He's not teaching anymore. But they've down through the years, they had the SOS courses and the IPSO courses kind of came together. They had different names. NGA was another one. Niles Gachet and his associates. IPSO started in about 2010. And as I said, the internationals, because we teach over in England, we had one of our instructors at that point was part of the faculty as well. We have a hands-on philosophy, which is that we teach courses with patients in their community, in their practice, and their patients with their hands, versus going to a program and watching somebody else, one of the experts doing it. They're doing it themselves on their own patients with us there at their shoulder, helping them out. And so our courses are basically restoratively oriented because it's a continuum. It's not a TMJ course. We have our first courses are called the 3-day, or it's occlusion in everyday dentistry, which Paula had up earlier. And then it morphs into hands-on, actual hands-on treating your patients. So the first year we have 4 patients, three are, there's 3 plus 1 actually. 3 have muscular or extracapsular problems that they treat with a splint and with in equilibration with them doing it there to carry that relief that they get from the splint. And then the last patient is a clicking, popping patient whose jaw joints click or pop. And when I was going through, before I got to this course, I used to say, well, you just have to live with it, but we don't believe that that's the case. Depending on how much damage there is, we feel like most of those can be salvaged and corrected and make people feel good to get together again. But they're, otherwise, they can worsen and create some tremendous problems in a patient's life. So here's the first course that we teach is the occlusion in everyday dentistry. Again, the course dates are June 24, 25, 26. It's here in Denver, which is, I live outside of Denver, but we all worked in the Denver area. This first course is basically didactic, probably 60% didactic, and there's probably 40% that you can take back to your practice and start to use on that following Monday. And it's a Friday, Saturday, and Sunday, and that's what Ken and Dan are doing in England right now. The program, as I said, is basically for restorative dentists, but it's also for orthodontists. And a lot of general dentists now are doing orthodontics Invisalign. So, you know, basically orthodontics is a full mouth reconstruction. And so you need to know where the joint is, what's going on with the joint, and how the teeth come together with the occlusion. So we already have 2 orthodontists signed up for June right now, but it's also for endodontists, periodontists, pediatric dentists, lab techs like to come, prosthodontists as well. So with this video that's in there, here's the topics that are to be covered that's on the screen right now. But Ken does a really good job of going into a little more detail with that, and I didn't want to go and rehash that because he does such a good job on the video. So our website is ipsoseminars.com, IPSO, and you can see it at the top there. There's an S at the end of seminars. And if you want to contact anybody, you can call me or Ken or Dan. Our phone numbers and our contact information are in there. There's Ken speaking. This is our group in Denver a couple of years ago. And it's the cost is called Occlusion in Everyday Dentistry, and the cost is $19.95. It includes lunches, and you can bring one of your assistants or dental hygienists, which we really strongly recommend because they're great sellers as well. They really buy into this. In fact, both of my assistants have gone on to other practices since I retired. Elizabeth, who Paula knows, is now working for Dan Sellner, who's my partner in the IPSO course. She's taken on their TMJ department and is running it all by herself as an assistant. She's outstanding. And Meredith has also gone back to another associate that I had before, and she's running their program as well. So
That's neat. That's good to know.
this is on the far left. I guess I can't point, but there's Elizabeth and Meredith. They're both in there.
Right.
A couple more things to say. It's not the typical learning experience because you're going to be immersed in it, and you'll never look at dentistry again the same way, whether or not you use this information, because it's such a hands-on program. My Simon Sinek moment for Eric is that this type of dentistry gave me a dopamine hit all the time. And I'm not kidding about that because it was the most gratifying thing that I did every day. You can get in and do drill and fill, and that's fine and dandy. That's what we've all been trained to do. But to make a real difference in a person's life was huge for me. That's what kept me going. What kept me going to the practice every day. I was able to provide beautiful dentistry that lasts a long time. But I had patients, and I'll give you an example. Is that I had a patient that was in her 80s, Mrs. King. She wanted to be called Mrs. She was a nasty, snarly old snag, and I did not like to see her at all. She'd had pain, she said, since 1954 because she had a root canal that year, and from that day on, she had pain in her jaws, and she blamed it on the root canal. Ultimately, it became a difference in her problem with her occlusion. We treated her with a splint and then recommended an equilibration, but the splint brought her out of it. She told me, she said, I just love you. I didn't believe this was going to work when we started, but it did. I recommended transferring the bite to her teeth so that she would maintain that. And she chose not to, and we didn't see her for 3 or 4 years. And then she came back, she said, oh, that root canal's killing me again. And she broke in her splint and ground through it, checked it again, and she was just out of whack. So we restored that, and immediately, like within a day or two, she had complete relief again. So it makes a difference in patients' lives. That's my dopamine hit, and that's what kept me going to the very end. It's also a big practice builder for this because these patients with this kind of pain and discomfort are everywhere. And they've been to see everybody. Nobody else can treat them a lot of times because most dentists are not taught what we teach in dental school. So it's.
I've got a question for you. I just talked a lot about.
Sorry, Eric.
Well, I just talked a lot about large case acceptance, right? That's really been
exactly that's where I was going with that.
And this is a direct connection to that. When we said $20,000, what masterminding here, Ted? What was your thought when we said $20,000 case or more? What did you feel like? Too little, too much? Right there. What was your thought?
I thought it was when I was doing it was probably $50,000 for a mouth case.
And when someone comes to
75.
Okay. And when someone comes to IPSO, you're really working with them on how to do those large cases. That's the connection, right?
Right.
Yeah.
It's there. They've torn up their teeth. They may need some ortho or Invisalign. If you're doing that, you need to kind of set a team up also where you have an oral surgeon to help you with arthrocentesis cases for cases where their jaws are locked. We can fix that later on. Most usually, if they don't have enough damage, orthodontists are key. They kind of hold the key for what can be done. My orthodontist went through our program, and he became my biggest referral source. And so you have big cases just waiting for you because they've torn up their teeth, and they've already built trust in you. And so there's what from the old days in dental boot camps called an obligation vacuum. They want to be there they feel like they owe it to you, and they're you're their best friend, really.
Yeah.
So
good when you're getting referral sources. In fact, Dr. Morell's team, who's here, yesterday, our team meeting was on having physicians refer to you.
Absolutely. Had that too.
Yep. I'm sure you had that, right?
Yep. We put together team physicians, ENTs, especially for the airway. Airway is huge.
That's
we
what we
didn't
said,
believe that.
Right, Sophia?
I didn't believe it when we started, but now I'm convinced that is a big part of the problem. So you put together a team of orthodontists, oral surgeons, ENTs, and it's hard to find some of those people, but you got to just keep digging and put it together.
It's worth it. It's worth it to do those large cases to make a difference in your practice.
Exactly.
Absolutely. Beautiful.
I remember you having a schedule of lunches that you did with referring doctors, and the letters. I still have copies of some of those letters that you sent out to physicians and cardiologists and ENTs and neurologists, and you did a program, and you really got out there and shared. Some of them didn't like being in their territory, but you began to get some of those referrals over time, didn't you?
We absolutely did. You have to be kind of a turtle with a shell sometimes and let it just roll off your back. The ENTs, especially, I've seen worse, when you see tonsils that are touching almost, people can't breathe and they're grinding the heck out of their teeth. That's why you've got to find the types of ENTs that follow what you want. And there's pediatric ENTs and adult ENTs. So it's critical. Yeah, you've got to do some legwork. It's not as hard as you might think. Get a little rejection once in a while, and it's good for you.
That's how you grow, stretching, right? You're either stretching, exactly. Everybody's stretching. You're either stretching higher or you're stretching lower. You're going one way or the other. There is no, I'm just going to lay right here. So yeah, you want to stretch yourself. You want to challenge yourself. And you want to constantly look for ways to improve. And this is a great way. If you're not getting physician referrals, if your specialist isn't referring to you, we have to talk about that. We'll talk about what you do, whether it's systemic connection, occlusion, TMD. I can't remember, Sophia, what else we came up with. What was the other one we talked about? So that practice I was talking about with the 2 days of hygiene, producing what they're producing, we have our referral slip in for physicians to refer to us. Why? Because the work she does with implants and helping save lives through quality of life, through systemic, whatever it is. So got to have it. Got to be part of your practice to take it to the next level.
There, you have a form already printed. They fill it out right there and then send it, give it to the patient, and they call us right off the bat. You bet.
That's right. Beautiful. Thank you, Ted.
Just looping back to the mission statement that we talked about earlier, we used to say changing lives one smile at a time. Now it's saving lives one smile at a time.
Exactly right. Yeah, that's airway, sleep apnea, you bet. Correct.
Absolutely. Well, thank you so much for sharing. And again, those dates of your next course are the end of June in Colorado. Everybody loves to go to Colorado, right?
Right. It's beautiful in the summertime. It's dry usually. Yeah, we'll be past the rainy season. It's a good time to be there. It's nice and warm, dry.
Still have snow in the mountains in June?
Maybe early June. Got a little bit